Hi, I'm Elizabeth. I'm going to be the social worker working with you. Can you tell me your name and date of birth?
Yes, it's going to be Samantha, and it's going to be 4/23/64.
Okay, so I was just looking over the referral that we had got sent over. It looks like Dr. Z had sent a referral over for you. It looks like he's seen you in the clinic. Can you tell me what was going on or what's been going on with you?
Yeah, I've just been getting really uncomfortable, like just getting really anxious and sweaty palms and just not wanting to be in social situations. And it makes me, um, get sweaty and clammy. I get clammed up, and it just makes me really uncomfortable.
Gotcha. Have you had any other symptoms associated, maybe like heart palpitations or maybe nausea, shaky hands, any other kind of symptoms associated?
I do get nervous and anxious, and it makes me get shaky hands. I do have like racing thoughts, and my heart starts racing, and I just kind of get really anxious.
Gotcha. Have you ever had any symptoms like this in the past, or is this something that's just recently started going on?
It's been going on for about 8 months. I started having just like panic attacks, and I would when I really freaked out, and I would get really sweaty, and I would get racing heart, and I would just panic and have trouble breathing sometimes.
Okay. Would you say there's like any certain things that trigger these feelings, that's triggered it in the last 8 months? Has there been something maybe in your personal life that's happened or something like a big change has occurred?
Just like social situations really make me nervous. I just don't like being around people. I don't like being around large groups. It makes me nervous. Um, it makes me get really sweaty and panicky, and I just really feel uncomfortable.
Gotcha. Has this affected your everyday life? Like, for example, maybe you're not wanting to go out and do things that you typically would normally go out and do, or maybe missing hanging out with friends or family, or has it had a major impact on how you're living your day-to-day life?
It has. I find myself not wanting to go to family events. We used to have Sunday dinners every weekend, and I just find myself avoiding those situations. When I'm at work, I no longer go out to lunch with a group of friends, and I just get anxious at the thought of it. I get sweaty and clammed up, and I don't want to. I try to avoid those situations of social settings.
Gotcha. In the past, have you ever pursued any type of treatment for like mental health or therapy? Have you ever looked into pursuing or in the past maybe you pursued it?
I haven't, but now that it's becoming an issue for me and I see how it affects me, not being able to like hang out at family's house without feeling uncomfortable and getting panicky or going, I can't even go to a movie. I used to love going to the movies, but the thought of being in a crowd around people, just makes me almost hyperventilate, and I get sweaty palmed, and I just get nervous, and so I just avoid it.
Yeah. Um, do you know if your family has any past medical history of like anxiety or depression or any other kind of like mental health disorders?
Yeah, so my mom also dealt with some anxiety and depression. And so I think that she worries about me a lot because she sees patterns that I'm doing, and she'll bring it up to me and say, just try and come. And she encouraged me to come to this therapy session so that way I can try and get back to my normal.
Yeah. Are you currently pursuing any type of treatment for these symptoms? Like, have you taken any medications, or is there anything maybe you do recreationally to help with these symptoms, like meditation or any kind of self remedies?
I don't currently am interested in trying something that would help me, but right now I don't really know what to do to kind of make the situation better.
Okay. Um, in the past, have you ever struggled with any thoughts of suicide or Any thoughts of wanting to harm yourself or others?
No, no, I haven't.
Okay. Um, Now you said this has just happened in the last 8 months or so, correct?
Yes.
Okay, and it's never flared up before, like maybe through middle school or high school, nothing like that.
Not really. I think I had like normal things like I would get shy around boys or things like that, but I never realized that it affected my everyday life like it does now. Now it affects me at work and social situations, and it's just progressed.
Not work, do you have to work with individuals? Like, do you have to maybe speak with clients or um, anything like that?
Yeah, sometimes I do because I'm a customer service rep, so
Mhm.
it does impact my job when I get anxious and I get clammed up and I'm not able to effectively help them because I'm almost in a panic attack and I just feel nervous and then I start getting sweaty and my heart starts beating really fast, so it does affect me.
Have you noticed maybe it's starting to get worse when you get to work, or maybe when you're at home that you're not having as many of these symptoms?
Yeah, it does get worse when I am at work or when I actually make myself go to a social situation. Um, like if I do go to a movie, I wasn't able to stay the whole time because I just got nervous and I got anxious and my heart started beating really fast. And so I ended up leaving. And once I'm at my house, I'm able to calm down, and things feel better, when I am at my house.
So would you say it affects maybe your attention span and how you're able to complete your work, like do your job efficiently?
Absolutely. Yeah.
Okay. Um, so I think, we've went over a lot of good information. I'd like to continue to, come up with some plans, and maybe what the best course of treatment would be. Would you be interested in meeting with a psychiatrist to maybe look deeper into some of these issues and maybe determine what kind of best course of treatment would be for you?
Absolutely. Yes, I would love to do that.
Okay, so I'm going to refer you to a psychiatrist to see. But before we go, I'd like to talk about maybe some options of what would you say some goals would be for your treatment? Like what would your ideal outcome be?
I just want to be able to go to family outings and not have to be anxious or have any panic attacks or just be able to hang out and kind of just be normal. I want to be back to my normal and enjoy social outings and going to the movies and things that I just or even going to work without having a panic attack or feeling anxious and having racing thoughts or
Mhm.
any of those.
So would you be interested in like looking at medication alternatives or wanting to try therapy first and seeing how that maybe helps alleviate some of the um, situations and things that you're dealing with?
Yeah, absolutely. I
Okay.
think that trying some therapy would help. I'm willing to do anything.
And maybe with therapy, they could help come up with some coping mechanisms. And those could look like different things, such as breathing techniques, maybe journaling, finding an activity that you enjoy and that you could fit into your daily schedule. Is there any kind of activities that you enjoy doing or things that maybe take your mind off of the current things that you're dealing with?
Yeah, I used to love going to the gym, yoga, and I avoid it now because of the crowds, but I would love to be able to try some of that and get back into to exercising and yoga.
Yeah, and maybe something you could start off small by doing. Maybe getting a yoga mat that you could practice in, your own home, and that way you don't have to worry about looking at a crowd or worrying about other people's opinions. And so that kind of might be like a good way to like bridge, um, you know, and having an activity that you previously enjoyed, and getting kind of back into the swing of things. Um, So, okay, well, I'm going to make this referral for the psychiatry, and then we'll plan to meet again, say maybe in a week or so, and we'll figure out a time that works best with your schedule. That way we can work around some things. Do you have any questions for me or anything else that you'd like to maybe talk about or bring up?
No, not at this time. No, I think that we've covered it.
Okay. All right. Well, I appreciate it, and I will meet with you again next week then, okay?
Okay, thank you.